It's not because I don't like you, it's just that the noise is disturbing to the rest of the call. But you can easily unmute yourself. If you're on the computer, there's a little icon down in the lower left-hand corner. It looks like a microphone, and it says mute under it. If it's got a red streak through it, that means you are muted. If it's blue, that means you're hot and we can hear you. So if you're eating dinner or talking to other people, we can hear that. If you're on the phone and you're visually impaired, *6 is the way you mute yourself and unmute yourself. *6. So if you have a question and you're on the phone, just go ahead and unmute yourself and try to find an opportune moment to butt in. But if you're on the computer and you have a question and somebody else is talking, go ahead and use the chat. Put the question in the chat, and we'll definitely bring it up, and we'll call you out so that you can become unmuted when we get to that question. And thank you very much for attending. Tonight is our inaugural trial balloon of streaming live to YouTube and other platforms. I believe we're YouTube and Instagram tonight, but we'll try to add more as we go along and get this show out there a little bit more. So, yes, tonight I was thinking that maybe we could start off with a topic, and as more coaches come on, we can ask this of the coaches. Uh, but I'd like to hear what's the most common questions when people ask you what is a holistic cancer coach, um, or what do you do as a holistic cancer coach, and secondarily, I'd like to talk about what we're here for. We're here for a message of hope and empowerment and personal accountability, because that's what it's all about. We're taking charge of our health. We're not we're not victims with our cancer diagnosis. We are partners in our healing, and uh, and we're going to give you any kind of information that you might need on that. We can't be specific to your medical diagnosis because we don't. The coaches don't know you enough. They would have to do an interview with you to get down to specifics, but we can give generalized answers that would help anybody. Okay, so if anybody has a question, go ahead and pipe up. If not, we'll start with what I was talking about. What is a holistic cancer coach, and what do people usually ask you? Okay, so nobody's talking, so go
I
ahead.
have a question.
Oh,
Did
Kat,
you?
that's right. Sarah did have a question. She wrote
Yeah,
in before the show.
yeah, I did send in a little bit of information to you and to Catherine. I don't know if you got a chance to see it, that I wanted to just address my question. And that would be, the background is my husband has a small amount of prostate cancer, but no tumors or anything. And he did Tulsa last year, which is ultrasonic partial treatment of the prostate. He did it last June. All right. And now he just got some more up-to-date tests. So this is about a year later. Okay, he got some more up-to-date tests. And he has been doing some good things, like we're eating more plant-based. We really reduced sugar only to one dessert, if desired, a week. We really reduced it. He reduced his animal proteins to just 2 or 3 a week. He's allowed if desired. And so he's doing a lot of good things for himself. And still should drink more water and less coffee. So he has some things to work on. But the problem is we just had this PMSA test and then also a prostate biopsy type thing. Okay, so those two tests were done, and he's been actively finding out what these tests are. He has a engineering background, so he can actively find out what they are, whereas someone who is doesn't have to, lives in a poor area or something, might not be able to have access to this sort of information he's able to get. So let's see. So what we found out on the test that there was slight increase in what they call the Gleason score. A Gleason score is a way to rate different parts of the prostate. And in some areas it went up a little bit from like a 6 to an 8. Many of the areas there was no no cancer whatsoever, but in one area it went up to like a 9. But in many of the areas it was just everything was just fine and there was no increase. And there were absolutely no tumors seen anywhere on either test, none at all, which is really great. I said, that's wonderful. That's really great. You're doing great. And what I don't understand though is now the doctor said to him that because you have slightly higher Gleason scores, we want you to do radiation. And we want to get rid of the whole, not just part of the prostate, but the whole prostate. And I thought he meant they would just do 1 or 2 radiation treatments. Certainly, they're not going to be real harsh with him. But he said, no, they're doing 10 radiation treatments, and we just have to get rid of all those. My husband's going along with them. We just have to get rid of all those cancer cells. But there's no tumor. It's a slight increase in Gleason. And I want him to start thinking, well, what can you do to get those? There's no threatening thing here. There's no tumor. What can you do to get those Gleason scores down a little bit by maybe getting some of your root canals removed, because he has problems with his root canals. Maybe if he doesn't want to do that, he could brush his teeth several times a day and gargle with salt water 5 times a day. You know, if you really don't want to get rid of, there is decay in these root canal teeth, and they are giving out, I understand the bacteria are anaerobic and give off toxins. So that makes it harder on your immune system to fight all the cancer in the different parts of the body, including the prostate. So I'm trying to encourage him to do something different rather than just listen to the doctors. And I see no reason at all for 10 radiation treatments.
Yeah.
But the doctors have to follow standard of care, and they're nice people.
Correct.
And
Right,
I'm very mixed up. I'm very mixed up.
Right. We talked about this a little bit last week, and we certainly would condone going for a second opinion. And if you want to go for a second opinion with a holistic oncologist, you want to look up the acronym FABNO, FABNO. I believe that's correct. Somebody put it in the chat if I'm not correct about that. FABNO, FABNO. And they would be the ones that would have a little bit more holistic idea of a type of a treatment or recommendation. I think going for a full-fledged radiation is probably well, I wouldn't want to do it myself personally. That I can only speak for myself. So
Right.
that would be the first thing. Encourage him to take his time and get a second opinion.
Thank you,
In the
Tom.
in the meantime, definitely get those teeth addressed. I just had a tooth pulled, and I'm not replacing it. Just if they're not in a place that you can see them, I would suggest that you just get rid of that problem.
Right,
That's
because
my
I understand some people have a root canal and, you know, they're not, it doesn't bother them, but other people,
yeah.
I have
Well,
an Huggins book, you know, and other
yeah.
people, they react more, and everybody's different. You
Yeah,
know, like,
root canals. There's just
yeah,
they're saying it out loud now. The dentist that is just drill and fill. There's no way for them to get everything out before they pack up the tooth again.
right.
So a lot of times these root canals manifest into problems many years later, like mine. In the case of mine, it's 30 years later.
30 years
You know,
later.
I have a problem, and then finally the
Wow.
tooth cracks. So I will let Catherine address more now, but that was my 2 cents.
Mhm.
Thank you, Carl, and I absolutely support everything you say. And that second opinion, Sarah, I really think an integrative oncologist may be the answer for you. Someone who is practicing medicine but utilizes integrative and alternative concomitantly, so that he is receiving complementary care. I believe you are doing the right thing as far as, and I know your husband is following a good diet, and I know he's doing flaxseed muffins, and I know he's hydrating well, and I know he's doing mostly plant and whole based diet, which is great. So you know you are doing everything that's necessary. I wanted you to go to an integrative oncologist because I am concerned when there is no tumor that they want to do full radiation when there's just little variants, and there is always variance in tests. That's can be normal. Okay, so and it could be many reasons for that variance to occur. Okay, so I would suggest that second opinion be with an integrative oncologist, continue on a good diet like he has. And you were commenting about coffee, and that, and he only has a cup a day. And you know what? I still often have a cup of coffee in the morning, even though I am drinking green tea with ginseng and honey most of the time, or I use turmeric, ginger, and a unpasteurized honey slurry, and then I put lemonade in it, and I make my own lemonade, and that's a refreshing drink. But keep hydrated, make sure that he's managing and continuing a good whole food diet, and I'm a little concerned that you're saying that he about doing full radiation when it's been 3-4 years now since he's had his prostate original surgery, right?
Oh, it's been 1 year. 1 year.
Oh, only 1 year? Okay. So just think about an integrative oncologist to bring on board so that you are getting a true holistic opinion. All right?
Yep. I put in the chat. It is Fabano, Fabano, and I put in a link for you to the association that certifies them. And I believe there's a list there, and you might find doctors in your area.
Or integrative oncology.
That's a good place to start. Yep. It's
yeah.
Yeah, the Oncology Association of Naturopathic Physicians is the certifying body.
Oh, they're certified by naturopaths.
Yeah, it's Oncology Association of Naturopathic Oncologists.
I see. Okay, good.
Yeah,
good.
so it's the certifying body, and it's a good place to start.
Thank you so much. Yeah.
Yeah.
Okay. Yeah.
Especially if your husband's responding to, wanting to go down that dire road.
Yeah.
Wanting what?
To go down that road that could be harsh
of radiation. Yeah.
Yeah. Just take your time, get a second opinion. You have time.
Yeah.
Take time, right? Take time. Yeah. Okay.
Yeah.
That's good. See, the other thing I have to think about is myself. If he starts following these people, and I know that his care is overly aggressive, and he believes everything they say, then I'm the one who gets all upset. And I have to take care of myself and stay calm. And that's why I wanted to truly understand just what each option is here. So
right.
the house calm and happier.
And you know what? That's hard, because being the spouse of someone who has cancer, you want to support him and understand where he's at, and you want peace of mind just as much as he does. Yeah. And the important thing is both of you feeling that you are in control. All right, that you are going to the right sources to get information. You are looking at the right sources and be directed to good sources as far as doctors and information on cancer. And I think you're doing the right thing and you're following the right steps. Sarah, you are in becoming a cancer coach, or you've taken the program actually. And I think, you know what, guiding him takes patience. But I know when I was working in intensive care, that my colleagues were floored that I was not following procedure with getting chemo and radiation. I agreed to a bilateral mastectomy because I was only stage 1.5, 2. And I said, I'm going to do that and then follow the rest naturally, where I did, but as you know, I've lost 40 pounds. I'm exercising and I'm following a pretty good diet of mostly whole foods. Okay. And I have fish, I like salmon. But majority of the time, I'm following a pretty good integrative medicine and diabetic type diet. So I feel very much in control. I feel confident about what I'm doing. And that is where you need to be as well, so that you can feel comfortable in supporting him. So, call me, call Maya, and just call us when you feel you need to hear, because that's what we're here for, coach to coach. We're here to support you too as you're going through it. Because I know how unsupported I felt as a medical professional and my own colleagues just being horrified. But when I told them, it's my life, it's my choice, they pretty well let that be and let me make my decisions. But it's hard to advocate for your care. And it's easy to get just to follow like a lamb, the conventional treatment. Because as you say, that is the standard of care. All right. That's why integrative or your naturopath oncologists are strong in this field and can also advise him. All right.
Yes, I
But and he you know what? I would like to see that he becomes a cancer coach, because I think you both as a couple would make fantastic coaches together, working with people that with through BeatCancer.org.
I agree. I agree. We do have a question in the chat, so we're going to move on to the next
Yes,
question.
we do. And the question we have is from Jerry, and he said, could you discuss the role of sugar in beating cancer? And I'm going to start off, and then I'm going to ask Maya to join in, okay? One thing I can tell you when it comes to sugar is that, number one, you have to cut the crap. The carbonated drinks, the refined sugars, the alternative foods, and the processed foods. But why refined sugar? One thing that we know for sure is that Dr. D. Agostino, and I'll put his name in chat in a few minutes, Jerry. Dr. D. Agostino is a cellular physiologist at the University of Southern Florida. He is at St. Petersburg, and he's the assistant head of that department. And he was doing want to work with the Navy SEALs. And by the way, he has fantastic TED Talks on this, okay? And what he found when looking under the electron microscope, looking at cancer cells and normal cells, he found that cancer cells have more insulin receptor sites. Well, isn't that interesting? And he did a whole bunch of experiments with rats and gave them cancer and fed them sugar, and then took radiographs. But what's important is that he then did a study those with a diet with no sugar and those with continuing the diet they were on. Of course, the ones who were on the same diet died, but the ones where he started reducing the sugar, you could literally see on all the testing he did and scans, the cancer recede. And what we do know about insulin receptor sites on the cancer cells is it makes sense. What is the role of insulin? The diabetic knows this. It draws sugar into the cell. So yes, the cancer cell needs that sugar to survive, okay? It needs the sugar, just like our normal cells do too, but obviously the cancer even more, which is why we're asking that people restrict refined sugar. And does sugar cause cancer? No, it's cancer's food. Does that make sense? Jerry, can you respond to what I've said?
Jerry, you're on mute. You would need a *6 if you want to speak. I think I can unmute.
Yeah, I can go ahead and if
Oh
you
yeah,
can.
there you go.
There you go.
Yeah, right. Yeah, thank you very much for that, and that's a good explanation. We're trying to do. I actually have stage 4 prostate cancer.
Mm.
I'm treating it with a very rigorous low sugar diet. That's what I'm working on. And there's controversy as to whether or not that's really effective, right? That's why I wanted to get your take on that. You're supporting that.
Yeah, and there's something else you can do. There's another study that's out there, and it's called the Flaxseed Muffin Study. It was started at the University of Toronto during COVID, and what they found is that the men with prostate cancer were divided into 2 groups, those who got flaxseed muffins and those who didn't. They fed them bran muffins or carrot muffins with flaxseed, okay? And what they found, because they knew it was going to be a 3 to 4 or 5 month wait before they could have their surgery. So what they did is they had the flaxseed muffins in the control group, and what they did is they found that there was a 50% reduction in the size of the tumor. Actually, that was 30%. And they had 50% reduction in the activity of the DNA in the cell, and they found apoptosis of the cancer cells. Apoptosis means death of the cell. And that's what we want to see. Now, of course, the US said, well, we don't know about that. So Duke University, I believe it was Duke, repeated that study and got the same results. And China came along and said, Western medicine, they know nothing. They repeated the study and got the same results. So Jerry, flaxseed muffins, you can look that up, and you can use flaxseed powder, flaxseed liquid, or flaxseed grounded. And I just take them in, and it has to be fresh ground flaxseed, okay? And each time you do it, and I just grind it like I would do in my coffee grinder, and I put it in the muffins. And now I'm using it for my husband, and he has them every other day for prevention, because his PSAs are going up a little bit, but he does not have cancer. But prevention, ounce of prevention is pound of cure, right? And I really feel across the board, if you have a history of cancer in your family, that you should be using flaxseed or eating flaxseed muffins at least every other day, if not every day, for preventative reasons. But that is one thing that they have found, that it did reduce the size of the cancer and also all the trauma around that cancer, okay? And that's important for men, okay? That's a really important thing to know, that that tumor cell shrunk. And so, Jerry, flaxseed muffins, and try to read those labels to decrease sugar in everything you eat as much as possible.
Okay, I would question on the flaxseed muffins, what else is in there besides the flaxseed? I do think flaxseed is a regular thing, but I'm also minimizing grains and other things that would increase the glycemic index.
Good for you. And I actually make gluten-free muffins. I use almond flour and other coconut flour and other products in my muffins. But I don't use flour. But you make normal brand muffins, or you can use a carrot muffin, whatever you choose, and just put in a quarter cup of flaxseed. And I also put in homemade applesauce for more moisture, because the flaxseed powder will give it make it more dry, right? And now that applesauce is pure apples cut up, and I use just cinnamon and a little bit of water. There's no sugar when I make that applesauce to add to it, and then the remainder of it I use for dessert during the week. So for moisture, I use extra applesauce. So, any other questions?
Well, I've been
Maya might want to speak up on
Yeah,
this.
I'm gonna be quiet and let Maya talk, because she has one of her own protocols, and I know Zach will definitely have something to say too.
Okay, what was the question? Like to eliminate sugar or refined sugar?
Yeah, no, he wants to discuss the role of sugar, cancer and sugar. So.
Okay. So the role of sugar, one of the main role of sugar, but sugar is not only a refined sugar. Sugar, we're talking about total carbohydrate. That everything falls under the sugar, because the body would convert carbohydrates into the sugar. So the role of sugar during cancer is it creates fermentation process inside the cell, the perfect environment for cancer to grow. So inside the cell mitochondria, the healthy mitochondria makes like energy, ATP, from oxygen and binding glucose. That process called oxidative phosphorylation, right? So when the cell gets damaged by whatever, chronic inflammation, infection, viruses, whatever, that process changes, mitochondria changes that process and converts it instead of getting the energy from like from oxidative phosphorylation, it would get the energy from fermentation. Why? Because it would create an environment for the bacteria or viruses not to survive inside the cell. So, but when the condition becomes chronic and the cell constantly in the environment of fermentation, so a mitochondria gets damaged, and that becomes a perfect environment for cancer to grow. So eliminating any form of that's why the sugar is the main fuel for cancer, because it would create that fermentation stage inside the body, particularly in the body where there's a chronic inflammation, where there's the hormones are compromised, the thyroid is not working right. And when there's a lot of stuff that's coming, immune system particular, when the immune system is down and cannot get rid of inflammation on its own. So this is the sugar, anything from carbs, anything from sugar is going to increase that inflammation process. And it's going to become for cancer a perfect spot to grow. So I hope that answered the question. That is I personally, my recommendation would be personally eliminating all form of carbohydrates while you have a cancer. You can add carbohydrates after you get clean, but during the cancer, eliminating all form of carbohydrates, so they won't get your blood sugar spike. Even though if you're not diabetic, your blood sugars are going to spike if you consume carbohydrates. And even high protein intake would spike your blood sugar too. So you have to know, yes, you have to know the fat is going to spike your blood sugar, protein is going to spike your blood sugar, because excess of amino acids are going to spike your blood sugar. So it all depends how often do you eat, and what size of your meal, because the sugar is not only thing that ferments. There's also glutamine amino acid could ferment. There's also amino acid arginine, ferments. So knowing how to eliminate a source not to feed the cancer, that would be the best way of going against cancer. Eliminating grains, all form of grains, it's a great thing to do. So I hope that had answered your question.
And I think that's why I found, especially white bread, because you get the instant high and then you get the low drop. If you're going to have whole wheats, then bread, then try whole wheat or ancient grains. But if you can eliminate those grains and carbohydrates, Mia, I absolutely agree with you. Do your best to do so. And there is flour in everything. So just like sugar, you really have to start reading your labels. And remember, when you're reading labels, if there's something on that label and you don't know what it is and you can't pronounce it, you probably shouldn't be eating it.
Yeah. And sugar is number one.
Sugar, and gluten. Yeah.
When I say sugar, I mean all form of carbohydrates.
Yeah, I agree.
The thing is, our body will take whatever it needs.
Yep.
So you have to put your body getting energy instead of glucose, getting energy from fat. This is the number one thing that people with cancer have to learn how to do it. And knowing the amount of protein even going into the body, also another thing, our body will take whatever it needs. The rest either is going to convert into the glucose and store, or it's going to come out of the body in form of a sweat and feces and urine, in that form. So I hope that answered your question, Jerry, right?
Yes, I'm sorry I had
yeah.
to mute some people because there is some background noise.
Yeah.
If you have a question, go ahead and
Okay.
hit *6 to unmute yourself,
And
you can ask a question.
Yeah, and Jerry, if you have a budget and you have a home, I recommend infrared sauna to get that some of that sweating out too. I really think it's a great opportunity, and you know if you're in a stressful job, being aware that deep breathing and good oxygen in your body is important, and so meditation, yoga, and deep breathing and removing yourself from stress is a key thing to get control of. And please continue to exercise. It's important that we exercise because the endorphins also help to decrease stress. Okay, so you have to take advantage of those friendly hormones like oxytocin, dopamine, serotonin being in the sun, and also the endogenous morphine when you're exercising. So, and instead of watching Rambo movies, watch things that make you laugh because that increases your endorphin levels too. So there are little things you can do at home and things you can change in your life that are not expensive, but it's taking a good look at how you're using toxins in your environment at home too. So try your best to use shampoos without paraben and other products. So be very aware of your exposure and try to limit exposure to toxins, but also a healthy whole food diet. The eliminating the sugar as much, specifically the refined sugars. Now you can say, what kind of sugar can I have? I do use unpasteurized honey, okay? All right. So, but other than that, that's pretty well all I use for any kind of sweetener. But I just got used to having my tea without sugar and stuff like that. But
But for someone who is going through cancer, they
yeah,
have to avoid honey too. You can do those afterwards, but for someone who is going through cancer, honey or anything, it's still going to spike the blood sugar.
it will. It can. And Jerry, you can go onto the BeatCancer.org site and look up Maya, myself, Sarah, or any of the cancer coaches that are in your area. And I'm from Canada, but I do know, I don't know where you're from, Jerry, but find out where you're from and find a cancer coach. And most of the cancer coaches are reasonable priced, and I fully recommend uh, taking the opportunity to maybe to even speak with Sarah there because her husband has prostate cancer, and we were just speaking about prostate cancer before you asked your question when we first came on. We were talking about his levels in treatment, and I've also worked with them in delivering some information. I did some presentations to them on immunology and stress, healthy food choices, psychology of cancer. That's for free for cancer patients. If you're interested in that, you can contact me. But I want you to find a cancer coach and who you're going to be comfortable with because it really makes a difference to have someone who knows your history and what you're going through and sending you to what sources are available in your area that are holistic or even bounce off treatment ideas and regimes and finding out what's right for you. Not what we tell you to do, but find what feels good to you. Because when you feel good and you feel control, you're confident in advocating for your care. And that's critical today in the medical regime. Now, let's go to
Nice,
another
nice.
question.
While we got a minute here, let's see if anybody else has any questions. Please feel free to speak up. It looks like we have a few people on the line that are new. So feel free if we're talking, you can go ahead and put it in the chat. If you're on the phone, you just have to wait for an opportune moment. If we don't have any questions, we can go back to my original question: what is a holistic cancer coach? And basically, when somebody comes to you, what kind of questions do they ask you? What are they curious about? And I'm not sure how many people are coaches on the line here. Um, Maybe you could raise your hand if you're on the computer through the reactions or just speak up. I know we have a couple, but this is an open question to all the coaches.
We have someone under a private number. Do you have any questions? That's 646 area code.
No, I don't have any questions as of at the moment. Thank you.
Oh, okay, that's great. And just
Thank
feel
you, thank you for
free.
joining in.
Yes, absolutely. And I hope we can help you, or you can refer us to others who can get answers and feel good about the answers that we provide for them and how we direct them. We have
Okay, thank you.
how about the 973? I think that one looks new to me as well.
I have a question.
And
Sure.
who's the,
Yeah.
Hi, this is Samaria, right?
Hey, Samaria.
Hi.
I have a question about finding breast wound, cancer breast wound, and I just want to know what is the best bandage to use on it, and any topicals that you recommend.
Is that breast wound like post mastectomy or just lump removal? What kind of breast wound are you talking about? Is there like a drainage?
Yes.
You have a tubes?
No, I don't have any tubes.
You don't have any tubes?
No.
You don't have drainage container like attached to your breast, do you?
No.
No.
okay. So you have just incisions?
No, no incisions. I don't have any incisions. I hadn't had any surgery or anything like that.
Oh,
Okay. All right.
yeah. Well, it depends on the type of surgery you're gonna have and what is it gonna be. Either breast removal. If with the breast removal, there's gonna be insertion of the tubes because the body fluid has to drip somewhere. So there's gonna be for a couple of weeks attached to a tubes and the little container for collecting body fluid. If not that, if it's a local, if it's local and it's going to be just a small incision, it's just a regular incision. You can use hydrogen peroxide, iodine to clean up the area, and you don't have to cover it because you have to let it dry. And yeah, you would have to let it dry, or maybe if the bra is going to irritate, you can put the Band-Aid on it temporary while you're wearing a bra. But if you can leave it open, I would say I would recommend that. Because that would be the best form of healing. The wound would heal better.
Okay.
Yeah, something like that. Unless it's a mastectomy, then it's more deep than that. Yeah.
Yeah, and Samaria, I had a radical mastectomy, and I had all my incisions were actually from the center of my chest, under my breast, okay, and underneath my up to underneath my armpit. But so none of my incisions show at all, okay, and I chose to put in implants. But many people choose autologous grafts, which is they take from your stomachs, fat from your tummy, or your back, or your buttocks, and they actually can implant. That's a lot of surgery. It's about 12 hours for each surgery. Or you can choose to go flat as well. So there are many choices you have because even if you're flat, there are a lot of adaptive clothing and adaptive wear to support you in that. So these are really very, very important decisions that you're talking about. But definitely, as you have wound care, it's something that you need to be talking about. I actually am an intensive care registered nurse, and actually my company is BeatCancer Shirts because I struggled managing my surgical drains, and I'm a nurse. So I hate to think what people go through. So if you have questions about your surgical drains, you don't have to necessarily buy my shirts. By all means, you can see my name there. It's Catherine at BeatCancer.Org. I'll put that in the. Just feel free to talk. Tell me about incisions that you have, and I'll be more than glad to tell you how to care for your incisions and how to care properly for your drains. And I have sheets where you can record the drainage and also give you information on how to care for your skin, how to care for your breasts before and after any of your procedures.
Okay. And could you tell me your name again? Because I'm on the phone. I'm not on the chat.
Oh, okay. My name is Catherine, CATHARINE, at
Okay.
BRACA Shirts, BRACA Shirts.ca. That's one word, BRCA Shirts. BRCA is the BRCA gene, which is BRCA, but I put an A in there because that's how we pronounce it, is the BRCA gene, so that's why I call them BRCA Shirts. But if you have any questions, I would be more than glad to just talk to you about wound care and drain care, anything else you need in relation to your surgery, or information in relation to breast cancer as well.
Okay.
And Sarah, and any one of us can. Any one of us can. All of us.
Okay.
And Maya has had breast cancer as well, so she as well can help you. And Sarah, I think quite a few of the cancer coaches at BeatCancer.org are knowledgeable, but we're also most of us are cancer survivors ourselves.
Okay. Okay. Thank you so much.
And
Okay,
please,
did you say BRCA shirt? BRACA shirt?
shirts, plural, shirts.
Oh, shirt.
Sure.
With an S at the end.
Yeah.
Okay.
Shirts.ca.
.ca. Thank you so much.
But and if you would like to take part in the education series that I do, it's a 3-day education program. It's free. Just ask Carl there or Zach, and they will or go to BeatCancer.org, and they can and just put in general information, and they can give you my number, and I'll send you a Zoom link, and we can set up a time when you can maybe you and Jerry can both listen, because it isn't necessarily just I talk about all cancers, but it's really good information about cancer and how you can holistically treat yourself. And then you can ask the other cancer coaches here and ask more direct questions that you feel are appropriate at the time.
Okay, that sounds great. Thank you.
Great.
Yeah.
Yolanda, is that you?
Yes, that's me.
Oh, okay.
People know each other without even seeing each other. I love it.
Yeah,
that's my sister. That's my sister. That's my sister.
Oh my God, this is wonderful. So you have a sister there supporting you. And do you know what? The most wonderful thing about having cancer is knowing who you can trust, who you can lean on, and having a sister that you can talk to as you're going through this process. I can't even begin to tell you how important that is. You just love the life you live, love the life you lead, and find joy and happiness in your life. And whether you're pre-cancer, during cancer, post-cancer, what's important is feeling good about where you're going, setting plans for defining who you are and what level of health and wellness you want to choose to be in. And because you want your health and your wellness is important, okay? And it's not my definition of wellness, it's your definition of wellness, because I don't know who you are and what limitations you have. But it's feeling good about where you are. And you know what? When you find love and family and support, and if you even have to have professional support, that's okay. And that's where the cancer coaches can also direct you to supportive care if you need it. So as you can tell, like Carl here is asking us what's the role of the cancer coach. He's already knows that we're here to educate you. We're here to direct you to good sources of information, not Mr. Google. And we're here to really provide you with suggestions that you follow up and investigate, because we want you to feel in control and to be proactive in your care. And so these are the things that both Maya and Sarah and I and other cancer coaches here will do, is support you in finding what is right for you and what you're comfortable with, based on who you are, what your diagnosis is, and how to go forward.
I have a question. This is Gwen. Actually, two questions. What substitute can you use other than refined sugar to sweeten things?
Go ahead, Maya. You should address this.
At the present moment, when people are having a cancer, I wouldn't recommend any substitute, because those substitutes are still contain compounds that can cause more damage instead of giving the pleasure of having something sweet. So I wouldn't recommend. I know some people are posting about monk fruit without erythritol, but knowing that the monk fruit, it's still been extracted by using heat. So the question is, would it contain all the beneficial compounds that people are talking about? So that's one of the things. So to be on the safe side, when people are on cancer and going through cancer and treatment, I would say avoid it. So that's my personal view on it. Okay, that's my personal view from all the research I've done. I personally would not use stevia because stevia damages nerve cells, and I would just skip stevia completely. I do not recommend. When it comes to monk fruit, if the monk fruit with erythritol would affect the microbiome of the digestive system, because erythritol is an alcohol. So it's still made out of alcohol. So it would still affect the microbiome. On the top of it, when there's treatments like chemo and radiation, that would affect the microbiome, and it's going to add. It's not going to add to your favor. You know.
Correct.
Damaging.
And microbiome, what? Can you explain to me what that is?
I've
heard that terminology before.
Your gut health.
Yeah, it's your
That's what I thought.
gut flora, like little bacteria, the friendly bacteria that makes our, those microorganisms that they basically play a big role in keeping our body healthy, helping like send signaling and neurotransmitters, all of those things. So when people when they have this microflora being compromised due to chemotherapy or any or drugs or medication or antibiotics, they become damaged, and adding other things. My suggestion to my cancer clients are always to focus on a whole food instead of adding any substitutes for anything, So whole food in terms of, it's better to eat like an apple itself, which I wouldn't recommend during cancer, then adding something sweet, like you said, stevia, erythritol, or any of those things. And plus, like some studies have shown that the monk fruit does spike insulin levels. So even though it says it's low glycemic,
spike it. It does. You said it spikes it.
It spikes it. Yes.
Yes.
Oh wow! I don't even know where to get monk fruit, so I wouldn't even know what to. Yeah. I guess you get it in a health food store. I don't really know.
It is. You can buy it from health stores, but it's just your mindset has to be focusing on healing cancer instead of getting some substitutes and trying to figure it out what can you do. The sweets are, it's something very hard to get to get detoxified from. People are, some studies and research show like if people detox from controlled substances easier than they detox from sugar, from glucose. So it is very hard to get rid of, but once you pass the 2 weeks, period, not consuming any sweets, your body is gonna adjust to that and change, Yeah.
Maya, when you're talking about no sugars and you're mentioning sweets, you mean no carbohydrates and things can easily.
No carbohydrates.
Sugar.
Yeah.
Right. Right.
breads,
So
pastas,
talking
rice.
anything that could convert into the sugar in your body.
Yes,
And
because your body knows how to break it down.
exactly, because like when you put in it stuff like let's say grains, uh, oh gosh, I mean grains, potatoes,
Bread.
anything that bread, all of those. It doesn't matter, gluten-free flours. It doesn't really matter. They still spike. They would in your body. They would convert into the glucose, and they would spike your blood sugar. There's a lot there's a lot of diets out there, particularly with the ketogenic diet. People are throwing a lot of stuff like sugar substitutes, like using almond flour instead of like regular flour. But then again, how much almond flours can you use? Almond contain high level of oxalates.
That's right.
What do you really want to go use the oxalates, because they're going to damage your body more? Oxalates
So,
actually link to breast cancer and stuff like that. So the crystals of
yeah.
oxalate damage to the cells, and they would link to cancer. So it's like do your research before you go and start consuming stuff. So I suggest like eating whole food. Whole food means like you can steam some broccoli, you can steam some cauliflower, in the whole original form,
And
without extraction, not extracted from
yeah,
anything.
it is really important that some of the things that you absolutely have to do when you're diagnosed with cancer.
Yeah.
Number one, you need to look at a whole food diet, okay? And of course, the elimination of carbohydrates, refined sugar, carbonated beverages, alternative food, and like donuts and stuff, chips, and processed foods and processed meats, okay? Try your best to cook at home, because when you cook at home, you're most likely to cook foods that are healthy for you, okay? That's not easy if you're working, right? It interferes. But also remember, decrease your sugar, whole food diet, exercise, hydration. It's also important to de-stress and to get sleep, because sleep heals as well. So there are many, many things you need to look at, which is why a holistic cancer coach can help you with any one of those things, and helping you set a plan and move you forward in your path as you're being treated, during your care, and then your aftercare treatment too, and supporting you as you start a health journey in making yourself better and focus on wellness.
We're down to the
Thank you.
last 1 minute here. I do want to add one thing about sugar alcohols like xylitol and things like that.
Yeah.
They've done rat studies where they've fed rats just regular rat food and sugar water and xylitol and regular water, and both in the sugar water and the xylitol it turned off the receptors in the brain to let them know that they were satiated, that they were full. So they both reacted in the same way to sugar and to the sugar substitutes. So it's in a negative way. So definitely want to not take those. It's kind of scary. We have no idea. Sucralose and those things I think are poisonous. But we're on the top of the hour, so this has been a great call. Thank you all for joining us. Thank you for joining us on YouTube and Instagram. And we'll see you all here next week at 7 o'clock Eastern Time, Thursday night, weekly call. All right, everybody have a good night now.
Bye, everyone.
Bye, everyone. See you next
You
week.
too.
Bye.
Okay, good night. Thank you.
Good night. Thank you.
Good night.
Good night.
Goodbye.